Catching his panting breath, he told the head nurse about some patient who had just had an episode of incontinence. The head nurse asked the name of the patient, and the minute the caregiver uttered her name, I could see lines forming on her forehead. Both of them discussed for a minute who will attend to this patient, because the one who takes care of her is on leave. Thinking it was my chance to shine on the very first day, I recommended myself. Are you sure? The head nurse asked me. I chuckled as if it was a very silly question. I've had training on attending old and disabled patients, so I know what I'm doing. The head nurse gestured for the caregiver to take me to the patient so I could give her a bath and a change of clothes. As I started to follow the caregiver, the head nurse called out to me and warned me. She told me to be careful. On our way to the patient's room, I casually asked the caregiver about her, and he said the patient is a bit weird. On normal days, she keeps to herself, but sometimes she can get violent, which is why they always keep her physically restrained.
She's been through a lot. Her abusive husband tortured her for years, until one day he came back home drunk and beat her badly. And then he killed himself too. If you ask me, she's way better here than she was with him.
The caregiver exhaled, and I realized things are about to get pretty serious around here. We stopped outside a small room.